So what's happening when you have cancer or some other chronic disease and it leads to nausea and vomiting that just won't go away? We're going to look at that today. We're going to talk about why it is when you eat and you have treatments for a disease or disease itself that this nausea and vomiting comes and just won't go away. So stick around for a little bit while we talk about it. The first thing we want to recognize is there is a distinction between nausea and vomiting that is caused by the treatments you're receiving. For instance, you may be getting chemo or radiation, and that is going to lead to nausea and vomiting. Or it may be the disease itself. Some people, they stop the chemo and radiation and say, I don't feel better. I'm still nauseous. I'm still vomiting. And other people may have other disease processes, like COPD and heart failure, and they're saying, why am I having such trouble with nausea and vomiting? That's not even related to my digestive tract, this disease that I have. So we're gonna talk about that, but we want to make that distinction that it could be medication induced or it could be just part of the disease process. If your nausea and vomiting is being induced by some medications you're taking, most of the time, once you cease taking those medications, the nausea and vomiting will get better. So what causes it? So what causes that nausea and vomiting? One is you're probably eating too much all at once and your body can't handle it. So the nausea and the vomiting is your body's way of saying, don't give me so much. Another thing that can cause that is you're eating food that is not easily being broken down and your body is saying, whoa, don't give me that right now. I can't handle that. Another possibility is you're giving your body food that is irritating it in some way or another, and it's saying, wait a second, I'm dealing with this disease. Please don't give me that food. Don't make me have to digest that because I just can't right now. It's an important thing to remember when you have a disease that your body is spending a tremendous amount of energy fighting that disease. And one of the things that we want to do when we get food and we have intake is we want food that requires the least amount of energy to convert to the energy that the body needs. As the more energy it takes to convert that food into something usable, the more energy is taking away from that body fighting the disease. And it's the same way if you've got the chemo or radiation, that medicine itself, what it's doing is it's a war of attrition. Basically, it's destroying cells in hopes that you can get rid of all the bad cells before all the good cells. You get to the point where you don't have enough good cells. So the body is just not wanting the wrong kind of food or too much food. And so we want to have strategies in place to help combat that nausea and that vomiting. And the first thing that you'd want to do is talk to your doctor, your provider, about getting medication that would help with the nausea and vomiting. There is a couple that medications that are very much in common use, like Zofran, ondansetron, or Phenergan, promethazine. These medicines are very helpful tools in a toolbox to help you with nausea. And you want to talk to your healthcare provider if you're having a lot of nausea, especially related to a chronic disease. You want to talk to your healthcare provider about that, about the nausea, about the vomiting, so that they can get you some medicine that can help you with that. Now, the thing with the Zofran, especially if you're just throwing everything up, they do make that in a dissolvable under the tongue tablet that you can take. I've seen Phenergan in a thing called a compounding pharmacy, a specialist pharmacy. They make creams that you could get the benefit of the medicine as a cream. Um, but if you have the pill versions that your doctors prescribe, one of the things to think about is the next thing that I want to share with you is that your body, if it has nausea and vomiting, is telling you to slow down, to not eat as much. So it may be that you might need to take that anti-nausea medicine before you do anything else. You might need to take that medicine, get a swallow of water, just whatever you can get down before you keep eating more things, and give that medicine time to work. And you want to talk to your provider about that and about that strategy to what we call pre-medicate. Try to take care of the nausea when you're going to engage in an activity that you know the nausea is going to go up. Another thing that you want to do and think about doing is changing your eating habits. A lot of us were raised where you have breakfast and then maybe you have a snack, and then you have lunch, and then maybe you might have another little snack, and then you have dinner. But mainly we're raised with the idea, especially here in the West and in the United States in particular, that we have breakfast, lunch, and dinner. And we get all of our calories together, fill our plates, and then we eat at these 3 times. Now, with nausea and vomiting, it really is your body's response to food and eating food. And basically, it doesn't want, it's just a reaction to what's going on in your body. So one of the strategies is instead of loading your plate up with food and trying to eat 3 meals and get nauseous and vomit it all up, is to maybe spread that out all through the day. Just take a couple bites at a time, a couple sips at a time, and just get your calorie intake over a much, much longer period of time. Also recognize that in the United States, we eat way, way more calories than our bodies need. On the average, we eat, many people eat maybe twice as much as what our body really needs to survive. And that's why we have an obesity epidemic here in the United States. And I struggle with that excess calories. And we can have this idea in our mind that this is what we want to eat, but it may be more than what we really need, our body needs. So we can look at and think about how we might spread our calories out through the day, and maybe to adjust how much we eat during the day. And also, we want to be careful about foods that can be very, very hard to digest, such as red meats and other things. Like we enjoy that, but it might be at that time in life that it's not the easiest thing for our body to deal with, and we need to move towards things that are more easy to digest, food that's more bland. And I have found a lot of people also talk about this, that often with high processed sugar foods and fried stuff can really be problematic when you're struggling with nausea and vomiting. When you think about drinking too, another thing you want to think about is how you don't want to necessarily chug down a 20-ounce bottle of water, but to just take sips throughout the day. And you want to do your best you can to stay hydrated. So you probably always want to have a water bottle nearby and take sips as you can tolerate it. I've also recommended for people to think about having high protein drinks, those nutritional shakes and everything, and taking a sip or two of those a day or throughout the day is also very, very helpful for you when you're dealing with nausea. And another hard part, I just want to wrap up with this. A hard part of this is to realize that you have a disease process, and maybe you're getting treatment, chemo, radiation, things like that, and you're very, very hopeful on the other side that the cancer will be eradicated and your life will return to normal. But there are times when that disease process just continues on. It's not successfully treated. And your body will have times where it's reacting to food or to any kind of intake because of the disease process. And becomes very, very hard when no matter what you're trying, your body just does not want the food. And you're probably going to get to a point where you just don't want to even eat at all. And that is hard for you. It'll be hard for your family. And that's a really important time, especially if you're going through these treatments and you have lots of nausea and vomiting and everything. This is really your time to be talking this through with your provider, to be talking with your family, and to be making plans for how you're going to deal with that. Because some people say, well, I'll just get a feeding tube. Well, that might not be the answer. The feeding tube might not do you any good, and it may not prolong your life more than you think. It may only give you, on average, it maybe extends life for maybe a week or two for people that are in that state where their body just can't process food anymore. Because the issue isn't just getting it down to your stomach. The issue is get the food not being able to be converted into energy because the body just can't do it anymore. And I realize that is such a painful, hard thing to realize, that with the nausea and vomiting and with the inability to eat, that it might not get any better. But I do think that the best solution, and what I would want to share with you if I was sitting right next to you, is just to encourage you to get help processing and talking about these things, because it can be challenging, it can be scary, it can be hard, it can just leave you emotionally a wreck, and really wanting to get some sense of peace as you think about treating the nausea and vomiting. There's always that bigger picture that you want to be thinking about. And I would encourage you again to talk to somebody, especially talk to your provider. Let them know what's going on in your thoughts and in your feelings surrounding your treatment. You always want to share that with your provider, because they're not just there to just give you medicine or give you treatment. A good provider is going to be treating the whole of your person and understand the whole dynamic of what's going on in your life, and give you advice and pointers, and maybe refer you to sources that can provide help to you. My name's Chris. I am a registered nurse who specializes in hospice care. I'm also an ordained minister, and I make these videos because I do want to get information out there to people that are struggling with end-of-life issues, because my goal is to see people have beautiful sunsets. We know the day of our birth is like the sunrise, and as we go through life, we go through all the ups and downs of life, and then the sun comes to set at the end of our life, and we want that sunset to be a beautiful sunset. It may not be an easy sunset. It may be very difficult and challenging, but we want to do everything we can, and I want to encourage that beautiful sunset ending of life, realizing that we all die, and that's a lot of what I'm doing with this channel. And there you hear my dog alerting me.